Hey y'all, Dr. Martin here. You ever wonder why when you're ridiculously stressed, that is the time when you get sick? Well, I'm gonna show you why with these. So first, let's talk about the difference between acute and chronic stress. Acute stress is like having to deal with an argument with your boss once. This is you, by the way. A chronic stress is having to deal with an argument with your boss who is annoying every single second of the day. Now, why is this important? Because acute stress and chronic stress have way different impacts on the body. These are your T cells. Why are these important? Because they lock on to an infected cell and they destroy it. These are catecholamines. Why are they important? Because they're released when your body responds to stress. You feel like coming into work every single day is exhausting. And as a result, the T cells are going away, but these catecholamines, they're coming right on in here. Why? Because you're stressed out. And your body needs to protect you. So it releases the stress hormone. You may find that you're getting outside less and spending way less time with your friends. You also find that you're probably not eating as nutritious food as you typically do. Stress is exhausting. So sometimes you don't have as much energy as you have to use your normal coping skills like working out. Now these are important because these things are protective factors, right? Coping skills are protective factors. Support systems are protective factors. Eating right, hydration, working out, just having time for you are all protective factors. But most of the time when we're dealing with chronic stressors, they're the first thing to go. So the T cells that are there to protect us from getting all sick, they're gone. The catecholamines who respond to stress, they all up in here. Now, of course, we want to have the catecholamines in our system because they help us deal with stress. But when they're in our system for too long, they lead to a bunch of different things. Adrenaline released into your digestive system for too long can cause ulcers. The catecholamines in your system, if they're in your system too long, they increase your heart rate, which can lead to high blood pressure. Catecholamines also increase your muscle tension to prepare you for fight or flight. If you're chronically dealing with that, you can have back pains, neck problems, all of that. The chronic catecholamines also cause an increase in heart rate. The result of that can be heart disease and other circulatory problems. So now you have all of these catecholamines and no protectors. So when this fool comes over here and sneezes on you, you're down for the count. So I'm well aware that many of us don't have control over our chronic stressors. So what do? We make sure we stay hydrated, okay? Try to eat more nutrient-dense foods. It doesn't have to be every flipping meal, but try to make it work. Identify a support system. Being able to talk about your current stressors really do help. Monitor your substance use. Caffeine counts as well, okay? I'm not gonna tell you what to do in your own home, but if you're noticing that you're only using substances to cope and every single second you can't cope without them, you got a problem. And last but not least, identify how many moments of joy you have each day. If you're not having at least 5 minutes of joy, whether that is looking at a meme, talking to your friends, or just drinking some tea, you're doing something wrong. That is a huge protective factor.